Hey, glad you're here today. I'm Randy Bond with Bond Insurance Solutions, and today we're talking about understanding Medicare. If you're like a lot of seniors, Medicare can be incredibly confusing. You have a lot of questions about how Medicare works, what it covers, what the costs are, and what your risks are. You're in the right place. We're going to answer your questions about how Medicare works. We'll cover the cost, when and how to sign up, and today we're talking about how Medicare Part A works. Welcome to Understanding Medicare 101. Hey, welcome back. Today we are talking about how Medicare Part A works. In 1965, Medicare came into existence with two main parts, Part A and B. Part A is designed to cover your inpatient hospital care. Part B is for your outpatient care. Now, later on in 2005, we got Part C and D, and we're going to talk about those in later sections. But for today, we're talking about how Medicare Part A works, what it covers, and how much it costs. So there's two important things to know about original Medicare. Number one, from the very beginning, Medicare was never designed to cover 100% of your medical cost. There has always been, from the very beginning, cost sharing that would come your way. And this is one of those important insurance-y kind of words, is coverage. Coverage does not mean that the insurance company, or Medicare in this case, is going to pay 100% of your costs. That's kind of one of the myths or assumptions that people have. When they say that they cover something, that means that they're going to help pay for that. Now, sometimes they would pay you 100% of the cost, and I'll show you at least one of those today. But for the most part, everything is going to have some cost share that would come your way. The second most important thing, and this is critically important, is that original Medicare has absolutely no limit. There is no limit on the cost sharing that can come your way. That's why it's important to know how much Medicare costs and to know that that pit for a financial crisis could be bottomless if you have a really bad health crisis. And so we are going to talk about some ways to help offset that. But for now, let's talk about how Medicare Part A works and how much the costs are for that. So Part A is going to help to cover your inpatient care. Now, if you get a Medicare card, you'll see Part A says hospital. But technically what Medicare means by hospital is inpatient hospital care. There are some things that you can have done at a hospital that are actually outpatient services that are covered under Part B. These are things like an emergency room visit or observation care or an outpatient surgery. All of those are Part B covered events. Part A is going to cover your inpatient hospital care. So you've been checked into the hospital, you're there as an inpatient, or you're in an inpatient mental health facility or a skilled nursing facility. So this would be like your rehab after surgery. Or one other possibility would be hospice care. Now, good news, hospice care is 100% covered. I hope you never need it, but you can just rest assured that if that event does come into your life, Medicare is covering 100% of the cost when you're on hospice care. That's some good news. So let's talk about if you do go into the hospital, maybe you have some kind of accident, some kind of health event that's happened, or you're going in for surgery, which is going to require you to stay a night or two or three. When you go in as an inpatient, there is a $1,484 deductible. It's kind of a good news, bad news thing on that deductible. That deductible is going to cover you for a 60-day benefit period. So what that means is that if you go into the hospital for 60 days, the bill that you're going to get from the hospital, now just side note here, Medicare is not going to send you bills, insurance companies aren't. Wherever you're getting the services like a hospital or a doctor's office, that's who sends you bills. Medicare will send you an explanation of benefit to let you know, hey, here's how much the insurance company, how much the hospital charged us, and this is how much we paid, this is how much your share is. And then you're also going to get that actual bill from the hospital. And if you're in the hospital for 60 days or less, your bill from the hospital in 2021 is $1,484. So that's kind of a good news thing. Bad news is, if you're in there for only one day, it's still $1,484. However, understand that the Part A deductible is not an annual deductible. It covers a 60-day benefit period. That means that if you go into the hospital and then you come out and 60 days go by that you're at home in good health, nothing's going on, and then 61 days later you go back into the hospital, you're going to get that deductible again. And so what that means is that that deductible could repeat several times in the year if you're having multiple trips to the hospital. Here's the reality. If you timed your injuries or illnesses just right, you could actually pay that deductible 5 or even 6 times in a calendar year. Kind of a crazy thought, but that could happen. So nearly $1,500 times 5, that's $7,500 that you could have out of pocket for your hospital cost if you had multiple trips to the hospital in a given year. So that's the deductible stage. And again, the deductible is going to cover you from days 1 through 60. Now, if you have a longer stay, days 61 through 90 are going to be $371 per day. So the $1,484 covers 60 days, $371 per day once you hit day 61 and beyond. Now, if you have an extremely long stay, this is when you're getting into the third element of Part A cost, and that is what is known as your lifetime reserve days. This is days 91 through 150. And your daily copay during that period is $742 per day. So that can begin to add up pretty quickly, and we'll give you some examples here in just a moment so you can see how all that plays out. But let me just pause here on the lifetime reserve days. This is an important section of days. The 60 days in your lifetime reserve days are just that. They are your lifetime bucket of days. It's like the moment that you come on to Medicare, Medicare gives you a bucket of days. And these can only be used on those hospital stays that are 91 days and longer. But whenever you use a day, it's taken out of the bucket forever. They never refill. You have 60 days, and if you use those one at a time, or if you use all 60 at a time, they're gone. And once you have used up all of your lifetime reserve days, or if you have hospital stays longer than 150 days, you pay 100% of your hospital cost. And folks, if you are in the hospital for 150 days or a very long time like that, you usually have something very significant going on, and there are probably some very expensive things that are happening. Medicare is not going to limit how much you're paying. Remember, there is no safety net on Medicare. This is why it's important to know here's the risk for being on Medicare, and you need to consider one of your options, either a Medicare supplement or a Medicare Advantage plan. We'll talk more detail about those in another section, but I just want to put those out there right now so that you know you do have options to offset your Medicare cost and to protect you from that unlimited cost. If you have original Medicare only, it's like walking a tightrope across Niagara Falls. All it takes is one health crisis to turn into a financial crisis that could wreck the rest of your senior years. And we want you to avoid that. We want you to have peace and security going into your retirement years so that you are protected financially and hopefully help to protect your health a little better so that you can get the care that you need when you need it. So let's talk about some possible situations so that you have a better idea of how this actually would work. So let's talk about Bob. He goes into the hospital. Bob has a stay of 59 days. What Bob can expect is that he's only going to be charged the deductible of Part A, which is $1,484. So the total for Bob's 59-day hospital stay is $1,484. So in our second example, let's say Bob goes in later on in the year and he has a 75-day hospital stay. He had something pretty significant that happened to him. The good news is, again, his first 60 days are covered under the deductible, which is $1,484. But he has 15 days left over. That's 75 minus 60, and 60 is the deductible period. So he has 15 days at $371 per day. So that's an additional $5,565 that's going to be added onto his bill. So that means that the total for his bill is $7,049. So the bill that he's going to get from the hospital is $7,049 for that 75-day hospital stay. Now, let's say, unfortunately, something really, really significant happened to Bob later on in the year, and Bob had a 100-day hospital stay. So remember, the first 60 days are covered by the deductible, $1,484. Now he's used all those 30 days of days 61 through 90, so that's 30 days at $371 per day. So that's another $11,130. Now he's using 10 of his lifetime reserve days. Those 10 days are $742 per day, so that's another $7,420. So when you add those three lines up, his bill from the hospital would be $20,034 for that 100-day hospital stay. And that is quite a bit of money for most of us. And so we want to look at some options there to help offset that. And again, that can be a Medicare supplement or Medicare Advantage plan. So let's talk now about the next part of what Part A covers, and that's your skilled nursing facility. So if you go into the hospital, you have some surgery done or something like that, you'll have your costs associated with that, and then you go in for your rehab. Here's some good news. Your first 20 days of rehab, when you're staying in the facility where you're staying overnight and having the physical therapist and so forth working with you, your first 20 days are fully covered. You don't pay anything for that. However, once you hit day 21, you're going to start paying about $185 per day. And Medicare covers you up to 100 days of rehab. 101 days and beyond would be entirely on your own, or you're looking at a different situation for something like that. So just understand, your first 20 days, no cost. Days 21 and following has a daily copay of about $185 per day. So word to the wise, don't treat those first 20 days like it's a vacation. I know, it's great to get away from the family and the spouse or whatever for just a brief moment, but don't treat those days like a vacation where you're just laying back, not doing anything, and enjoying just being waited on hand and foot. Treat it like you're Rocky Balboa. Turn on Eye of the Tiger and work out as hard as you can and get out as quick as you can so that you can avoid those daily copays if your health will allow that. So just kind of a word to the wise there. However, again, something like a Medicare supplement or a Medicare Advantage plan could help you save money on those skilled nursing facility costs. So that's kind of the way that Part A works. It's going to cover your inpatient hospital stays. There are going to be costs associated with that can come your way, and they can be unlimited. So if you are concerned about your Part A cost and maybe how to offset that or protect yourself from that, let's talk about a Medicare supplement or a Medicare Advantage plan and see which one would be right for your situation. If you'd like to explore those, give us a call, visit our website. We'd be glad to help you out. We're not married to any insurance company, so we can find the right plan with the right company for your situation. Everybody's situation is different, and we tailor your Medicare needs for your situation to help you make the most out of your Medicare benefits so that you can save the most money and enjoy your senior years as fully as possible. Hey, thanks for watching today. We're so glad that you tuned in. Join us next time. We're going to talk about how Part B works.